Hey guys, what's up? It's Stephanie. Welcome back to my channel. So in the video today, I'm going to be discussing what I have been up to. So I applied to a residency. So I passed my pants. I took my pants, thankfully, and now I'm in the process of moving to another state. So I'm originally from Texas. I'm moving to the state of Pennsylvania. And so if you've seen my previous videos, since day one of PA school, I've always wanted to apply to residency. And when I started PA school, I had worked in emergency medicine for about 5 years, and I really liked emergency medicine. But when I started PA school, I did not enjoy my rotation in emergency medicine as much, and I actually enjoyed my rotation in internal medicine, critical care. So I really loved this rotation that I decided to do a capstone rotation. What's a capstone rotation? It's a rotation that's about 4 months, 3 to 4 months, that my program has. Not all programs have this rotation. My program's a program that is 2.5 years, so you have 1 year of didactic, 2nd year of clinical rotations, and then that half semester, that the remainder of the half, it's going to be in a rotation that you want to specialize in. So since I enjoyed critical care medicine so much, I decided to do my rotation in burn medicine. And I really enjoyed this rotation. It kind of gave me like a little taste of what critical care was, and I wanted a lot more. So that's why I decided to apply to a residency, and I applied to a critical care residency position in the state of Pennsylvania. And so I will be waiting to see what I get in regards to that residency. So I have applied to it, and I just want to give you guys an update of it. Usually residencies are difficult to get into. For example, the one I'm looking at only accepts 2 students. Some residencies only accept 1. And the thing that you want to look for residencies when you are applying to them is, of course, how many students do they accept, what's going to be like the rotations you're going to be doing, what's going to be kind of the didactic. So if I were to get into this residency, I'll be doing 13 clinical rotations. It's 12 months long, and I'm going to be rotating through different parts of critical care medicine. So I would be rotating OB/GYN critical care medicine, MICU, right? So medical critical care units, trauma, etc. So there's different rotations that I'll be doing, and then we have 13. Out of those 13, 11 of them are mandatory by the residency, and the other 2 are going to be your choice. And another thing about this residency is that you actually get to train along your residents. So the physicians that just graduated from medical school, you're going to be training alongside with them. And they're going to teach you how to do all the procedures, so how to get more hands-on with chest tubes, placements, right, intubations, your ultrasound, use of ultrasound, which is something you really do not get taught in PA school. It's something you're more expected to learn hands-on when you're practicing. So that was another plus that I really liked about this residency. And another thing that you always want to look for and ask in regards to the residencies is, once you've completed the residencies, how many of these students or residents do get offered jobs once they graduate? And so that's what I'm in the process in. I applied online. I was researching everything to make sure I know everything about the residency before I applied. So I applied to it, and then I will let you know whether I was accepted or not. It's something that I really want. PA school teaches you a lot, but I don't think it teaches you enough to be in critical care medicine. That's my point of view, and I can probably get a lot of hate from this. But it just doesn't teach you enough to be in critical care medicine. And just for like ICUs, it's something that you're going to learn on the job. I've had some classmates that got already jobs as new grads to get into ICU, which is fantastic, but that's really rare. Usually they'll want you to have some type of prior background in like hospital medicine before you start ICU. And then especially with COVID-19, it's really hard for new grads, at least my classmates have experienced it, for getting jobs as a new grad in this post-COVID-19 era. Hopefully everything gets better, but as of now, and I'm just speaking from experience, it might be different in different states, but I know in the state of Texas, it's been really hard in certain areas, and I'm not going to say the area, but certain areas, to get jobs as a new PA just because of the saturation rate. It's oversaturated. And then a lot of doctors, they know that whenever they get a new PA, a new grad, they have to invest a lot of time on them to ensure that they practice right well, because of course it's going to be under the doctor's name. And so that's another reason why I decided to do residency, because I want to make sure that when I start practicing, when I enter the workforce, I know my stuff. Even though I feel very comfortable, but I want to get more practice with intubations, like I said, putting chest tubes, master like the ultrasound, just master radiology in general. And ICU, any specialty, you're dealing with patients' lives, but ICU is one of those where you really need to know your medications well, you really need to know your pathophysiology of the critical illnesses that you're treating, and you really need to know how to work well with others. So I'm really, really excited, and I will let you know what happens. Alright guys, as always, thanks for watching my videos. If you have any comments below, please comment below, or any feedback or suggestions for other video topics, let me know, and I will talk to you guys later. Bye.